Welcome to Conversations with Melissa, part of RenaFi's Experts and Influencer series. RenaFi provides practical, research-based advice, courses, and peer support, and focuses on the underlying drivers of our ADHD behavior. Through courses like budgeting for the ADHDer, home organizing for the ADHD lifestyle, and of course, our ADHD book club, to name just a few, we provide a holistic program that serves to help you thrive with ADHD, not in spite of it. Follow our YouTube channel for ADHD resources and information, and visit us at renafi.com to learn what we have to offer. Okie doke. Thank you so much, RenaFi. All right, and then thank you so much to our guests here, Dr. Bill Dodson and Beth Bardeen. So today we're going to do RSD from two perspectives. We have Dr. William Dodson, the clinician, what RSD looks like from the outside in. Dr. Dodson is a board-certified adult psychiatrist who does not have ADHD. He has worked with his adult ADHD patients for the last 25 years to understand and document rejection sensitivity dysphoria. Dr. Dodson has been on the forefront of diagnostic and treatment reform for ADHD and rejection sensitivity dysphoria. He is now retired from clinical practice and resides in Colorado. Beth Bardeen, the RSD survivor, what RSD feels like from the inside out. Beth is an adult diagnosed with ADHD after a 30-year career in the Seattle tech industry, specializing in marketing and organizational behavior. Now Beth researches rejection sensitivity dysphoria and is an advocate for the newly diagnosed, with a focus on explaining the internal experience of RSD. She lives in Seattle and is the founder of the Seattle chapter of CHADD. All right, thank you both for being here. And
Melissa, thank you.
I'm just going to step out of the way. I'm going to take the focus off me and let you have at it and interrupt you every so often.
Sure. And thank you, Rick and RenaFi too. This is, we love this opportunity, really appreciate it. So thank you again for the warm welcome. We're so excited to be here. Dr. Dodson and I have gotten a chance to work together on this for the last couple of months, and I'll tell you, the inside out and the outside in, it's a thing. So we've got to have our disclaimer, and as you know, for presentations like this, we're talking about our lived experiences and our research. It's for educational purposes only. Information in this presentation is not intended to diagnose or prescribe, nor is it a substitute for an established patient relationship, and it should not be taken as medical advice. So please work with your ADHD specialist team for your treatment plan. And there we go. And Melissa talked about our two different viewpoints. And we are starting with our takeaway messages right up front. So Bill, would you, or Dr. Dodson, would you like to, that's so familiar. Oh. Would you like to offer your perspective?
I have control of that?
You don't have control, but you can read.
Oh, okay. Yes, rejection sensitivity dysphoria is real. It's a thing, as it's very commonly referred to. And the vast majority of people with ADHD report having it. And for about a third of people with ADHD, it's the most impairing part of their ADHD. They've found ways around their academic and work performance, but they haven't found a way about that their lives can be turned upside down just by somebody scowling at them. You're going to find that there's very little training about RSD out there in the clinicians, because most clinicians get no training at all about ADHD, much less rejection sensitivity. 93% of adult psychiatry residencies in the United States do not mention ADHD in 4 years of training. So if you've got somebody that has any notion of what they're doing, you have found a gem. The good thing about rejection sensitivity dysphoria is that about 2/3 of people, about 60% plus, can get life-changing levels of benefit from medication all by itself. You're on. Oh, you want me to keep reading here?
No, you're good.
Okay.
So from my perspective, not only is it real, the thing that I've learned, I started out thinking that it can't be cured. You just have to frustrate with it. But what I've learned is that it's not just possible to treat and manage. You can actually learn to thrive with it. And it's a lot of work. We all know that ADHD is a lot of work. It was a lot of work before we knew we had ADHD, but at least once we know about it, we can focus our efforts on it. And it is fascinating once you start coming to the other side of it, and where I wouldn't say that I control my RSD. I can say that my RSD doesn't control me. And I personally have run into these well-meaning providers and people that care about me in the workplace, or family and friends who they're either going to reject outright that RSD is a thing, or they trivialize it by saying nobody likes to be rejected. Dr. Dodson has some really good information later on that compares these things and helps us understand what neurotypical people or just anybody might feel about rejection, and how that fits in. And that's a pretty helpful thing when you start wanting to talk to friends, family, coworkers about this part of your impulsive emotionality that you've always had. I think the thing that has been one of the most powerful things is connecting and relating with others. I started doing group boot camps up here in Seattle, and that changed my perspective with hope so quickly. And then when I started working with Seattle Chad, just the day in and day out of talking with people and seeing it's like we're all on a road trip. We're all going to get on the road. We're all going to stop for gasoline. We're all going to stop for food. But each one of us is going to, everybody's trip is different. We're going to stop at different places. And I think part of it is when you start to relate with others about RSD, is you can figure out what's common across everybody you talk to and how yours expresses itself uniquely. And that makes it so that you can more customize the different things that you're going to do for treatment. Let's see what the next slide says. So one of the things, thinking about what is RSD, how to recognize it personally. I mean, number one, you got to know that it's a thing. And when I think back to the first time that I heard about rejection sensitivity dysphoria, it was May 2018. I was sitting in the parking lot uncharacteristically early to my ADHD coach's session. And I was doing some of the homework, listening to an Attitude Magazine webinar with a Dr. Dodson, talking and describing something that I had never heard of before, but that I have lived with all my life, and I had known about it all my life. And I did not know that it was a thing because everybody in my family did it. And so I grew up thinking it was normal. I grew up in RSD soup. We all just had hot, fast tempers. We all just like, don't criticize them. You're not going to like it. And it was almost 60 years before I heard this. And I had so many different feelings about it. I felt vindicated. I felt confused because my reactions weren't what I thought they were. So as we go along and we talk about the different things, I want you to think about where you were when you first heard about RSD and what did you feel? It's one of those, I think, times that you won't forget. So, okay, what is it? Dr. Dodson has, I guess the word might be codified or documented over decades of working with people like us and thousands, I think, and seeing what the common indicators, patterns. So it's this intense emotional pain, and it is related to rejection, criticism, this feeling that you're not living up to everybody's and your own expectations. And something that I think a lot of people, myself included, confused it as the bucket for all of ADHD's emotionality. The thing that's different about RSD with the other parts of ADHD emotionality is it's really difficult to self-regulate without treatment. And people don't understand, we don't understand that it is not weakness. It is not a preference to not be rejected. It is an impairment. And so when I talk to people and they say, well, nobody likes to be rejected, and I'm like, does it impair you? Because it will stop me cold for hours. So even though it's not official, the thing that I think is most transformative is the treatment with the FDA approved medications that Dr. Dodd's going to talk about. And if they work for you, they lift you up so that you can start advocating for yourself, because nobody else is going to. And at least when you get on the right path, you not only can advocate for yourself, you feel like it. So I added this slide in because I think there's a lot of different, like rejection, there's a lot in that word. And there's a lot of different kinds of rejection. But the thing that matters most with, why do we feel rejected and sometimes and not others? And it's because context is so important. So do you have an emotional connection? Is the person who's triggering you, did you have a deep emotional connection with this person? Or is there a power structure? And then, your physical reserves, your sleep, are you hangry? Is there something that is preventing you from being fully available? There's different kinds. And I think this is part of where a lot of my confusion about ADHD's emotionality, the different types. But one way of being rejected is to have your value, your worth underestimated, questioned, doubted, directed, corrected, Melissa and I like to talk about being bossed. Nobody wants this. And it's a matter of having your point of view rejected. It's just that you're not valued, and it hurts at such a visceral level. All of these things, like it's like the exclusion, the isolation, it's like a big game of keep away. It hurts so bad, and it causes a lot of coping mechanisms. So it's part of our impulsivity. It always takes us by surprise. It always has a clear trigger. We always know exactly what started this intense physical pain. And it's often characterized as emotional discomfort or pain, but it's physical too. And we can have many in a day. I was working with a therapist before I knew I had ADHD, and she's like, you really need to bring these episodes to me to our weekly session. And I'm like, there's so many going on every day. I could never remember 3 of them or 10 of them. And it's so painful, and they can each one make us more weak. So we need the support systems and the armor for in between the sessions. We need the sessions, but we need something in between them as well. When we internalize, and everybody again is going to experience internalizing this pain differently, but we can feel physically cut off from others in our surroundings. Sometimes it feels like you're in another dimension. I sometimes will kind of be watching what's going on. Freezing like a deer in the headlights. That sounds like fight or flight. Black hole of despair, completely disconnected and trying to be understood, but never getting past being misunderstood. When we externalize, we feel anxious. It's like this physical thing, and it can get to a panic attack. And there's the being misunderstood. We're repeating ourselves, hoping that maybe this time when we say it, it'll land. We are wounded by the trigger. And some people, maybe me, lash out with the same intensity that I felt by the hurt. And it isn't anything that I'm even aware of until it's after it's happened. And it just kind of depends on the context that I was mentioning before, because different times, we're going to do different reactions.
We have a couple of questions that were on the thing you were just saying. So I wanted to make sure that we ask them. What do you mean by physically painful? And then is this physically painful like a somatic response?
Dr. Dodson might have a better way of describing it. For me, in the moment of the episode, I don't actually feel the emotions. I think a lot of the fight or flight, or I think depending on the trigger, or if it's associated with a past trauma, I might feel it in my chest. For me, I think it's part of the fight or flight that's kicking it in, the physiological response, but it's showing up physically, like in my chest, in my stomach. Dr. Dodson?
Many people describe it as being like a sudden punch to the chest, or being stabbed. It's a sharp, sudden, very painful physical feeling in addition to the emotional feeling. And well more than half of people talk about the fact that it is very, very painful. They cry out loud. It hurts so much. I have no explanation for why that is, but it's a fairly consistent feature.
We have a request that you go back a slide.
Okay.
And then there is a comment in the chat, someone else saying, for me, the adrenaline is overwhelming and it's when after it's over, I have to sleep immediately because I'm completely drained.
Yeah.
A lot of people relating to that.
It's a
Punch in the stomach.
catastrophic experience. You're hitting on every adrenaline nerve.
Yeah. I think, and I don't know the physiology of it, but I think there have been times when I have over exercised and I didn't feel the physical pain up to that point. But I think there must be, like you're saying, some sort of release of adrenaline that kind of hits, and then I have to shut down almost immediately after. Anything else?
There's other people putting their experience in the chat, a
Good.
punch in the stomach or a sudden cold sweat, or
Ooh, yeah.
just afterwards really clamming up. And feeling like maybe there's brain fog afterwards. So,
Yeah, those are good. It is, if you're not in it, it's fascinating.